Poor leg circulation after the age of 60 is most often misunderstood as an unavoidable consequence of aging, when in reality it is largely the result of reduced muscular activity, especially in the calf muscles. From a clinical perspective, the calf muscles play a critical role in circulatory health. They function as a peripheral heart, assisting venous blood in traveling upward against gravity from the lower extremities back toward the heart. Every time the calf muscles contract, they compress the deep veins of the leg, propelling blood upward and preventing it from pooling in the ankles and feet. When this mechanism weakens, circulation slows and symptoms begin to appear. As individuals age, daily movement patterns tend to change. Many adults over 60 spend longer periods sitting, walking less frequently, and avoiding physical activity due to joint discomfort, fear of falling, fatigue, or chronic health conditions. This reduction in movement leads to diminished calf muscle engagement. When the calf pump is underused, venous blood begins to stagnate in the lower legs. Clinically, this presents as ankle swelling, heaviness in the legs, cold feet, tingling sensations, muscle cramps, and in more advanced cases, skin discoloration or varicose veins. These symptoms are not merely uncomfortable, they indicate compromised circulation that can worsen over time if left unaddressed. Importantly, poor leg circulation is not always caused by blocked arteries or serious vascular disease. In many older adults, arterial flow remains adequate, but venous return is inefficient due to muscle inactivity. This distinction is critical because it means that targeted movement, rather than medication alone, can produce meaningful improvement. A simple calf activation exercise directly addresses this root cause by restoring the mechanical pumping action that the body naturally relies on. From a medical perspective, the effectiveness of a low-impact calf exercise lies in its ability to repeatedly contract and relax the calf muscles without placing stress on the joints. Each contraction gently compresses the veins, moving blood upward, while relaxation allows fresh, oxygen-rich blood to refill the area. Over repeated cycles, circulation improves, tissue oxygenation increases, and metabolic waste products are cleared more efficiently. This process helps reduce swelling, eases discomfort, and supports healthier skin and nerve function in the lower legs. One of the most important clinical advantages of this type of exercise is accessibility. Unlike walking long distances or engaging in balance-demanding activities, calf activation can be performed while seated or with light support. This makes it appropriate for individuals with arthritis, knee pain, hip stiffness, balance limitations, or early mobility decline. Because safety is a primary concern in older adults, exercises that minimize fall risk while still providing physiological benefit are strongly preferred in medical practice. Consistency is the key factor in achieving results. In circulation-related conditions, frequent low-intensity movement is far more beneficial than occasional strenuous exercise. Performing a simple calf exercise daily, sometimes even multiple times per day, maintains regular blood flow and prevents prolonged stagnation. From a clinical perspective, this regular stimulation helps maintain venous valve function, which is essential for preventing blood from flowing backward and pooling in the lower extremities. Over time, improved valve efficiency further enhances circulation. Another important benefit of restoring calf muscle activity is its impact on nerve health. Poor circulation often leads to reduced oxygen delivery to peripheral nerves, contributing to numbness, tingling, or burning sensations in the feet. By improving blood flow, this exercise supports peripheral nerve nourishment and may help reduce these sensory symptoms. Patients frequently report that their feet feel warmer and more responsive after several weeks of consistent practice, which is a positive sign of improved microcirculation. Clinically, improved leg circulation also supports overall mobility and independence. When legs feel heavy, stiff, or painful, individuals naturally limit movement, creating a negative cycle of inactivity and worsening circulation. By relieving these symptoms, a simple calf activation exercise encourages more confident movement, longer standing tolerance, and better walking endurance. This has a direct impact on quality of life, reducing dependence on others and lowering the risk of complications associated with prolonged immobility. It is important to clarify that while this exercise is highly beneficial, it is not presented as a cure for serious vascular disease. Conditions such as advanced peripheral artery disease, deep vein thrombosis, or severe heart failure require medical evaluation and targeted treatment. However, for the majority of adults over 60 experiencing early or moderate circulation issues related to inactivity, calf activation is a powerful preventative and supportive strategy. In clinical practice, such exercises are often recommended alongside medical management to enhance outcomes. From a preventive medicine perspective, this approach aligns with current best practices for healthy aging. Maintaining muscle function, supporting circulation, and encouraging safe daily movement are foundational strategies for reducing the risk of falls, ulcers, infections, and mobility decline. A simple, repeatable exercise that activates the calf muscles fits seamlessly into daily routines and does not require special equipment, making long-term adherence more likely. In summary, poor leg circulation after 60 is frequently driven by reduced calf muscle activity rather than irreversible aging. By reactivating the body's natural calf pump through a simple, low-impact exercise, older adults can significantly improve blood flow, reduce discomfort, and protect long-term leg health. When performed consistently and safely, this approach offers a clinically sound, practical, and highly effective method to support circulation, mobility, and independence in later life. This single exercise is particularly valuable from a clinical standpoint because it is safe, joint-friendly, and adaptable to the physical limitations commonly seen after the age of 60. As people grow older, the joints of the knees, hips, and spine often develop degenerative changes such as osteoarthritis, reduced cartilage thickness, and decreased joint lubrication. These changes make high-impact activities uncomfortable or even unsafe for older adults. For this reason, many traditional exercise recommendations become unrealistic for older adults, leading to further inactivity and worsening circulation. A low-impact calf-focused movement avoids these problems by delivering circulatory benefits without placing excessive mechanical stress on vulnerable joints. From a medical perspective, joint stress and circulatory improvement must be carefully balanced in seniors. Exercises that involve jumping, deep squatting, or prolonged walking can aggravate knee pain, hip stiffness, or lower back discomfort, causing patients to abandon physical activity altogether. In contrast, a controlled calf activation exercise can be performed in a seated position or with light standing support. This makes the exercise suitable for individuals with arthritis, knee pain, obesity, or balance concerns. Safety is a critical factor in any exercise prescribed to older adults. Falls are one of the leading causes of injury and loss of independence after 60. From a clinical viewpoint, exercises that can be done while seated or with minimal standing support dramatically reduce fall risk. By keeping the center of gravity stable and eliminating sudden movements, this exercise allows patients to focus on controlled muscle contractions rather than balance. This increases confidence and encourages regular participation, which is essential for circulation improvement. Another important clinical advantage of this exercise is its effect on oxygen delivery to tissues. When calf muscles contract rhythmically, they increase venous return and support more efficient circulation throughout the lower extremities. Improved blood flow enhances oxygen and nutrient delivery to muscles, skin, and nerves, while assisting in the removal of metabolic waste products. Over time, this improved internal environment supports healthier tissue function and reduces symptoms like aching, stiffness, and nighttime leg discomfort. From a neurological standpoint, improved circulation plays a key role in maintaining nerve health. Many older adults experience numbness, tingling, or a pins and needles sensation in their feet, often due to reduced blood flow or mild nerve compression. By improving blood flow, this exercise supports peripheral nerve nourishment and may help reduce these sensory symptoms. Patients frequently report that their feet feel warmer and more responsive after several weeks of consistent practice, which is a positive sign of improved microcirculation. Clinically, improved leg circulation also supports overall mobility and independence. When legs feel heavy, stiff, or painful, individuals naturally limit movement, creating a negative cycle of inactivity and worsening circulation. By relieving these symptoms, a simple calf activation exercise encourages more confident movement, longer standing tolerance, and better walking endurance. This has a direct impact on quality of life, reducing dependence on others and lowering the risk of complications associated with prolonged immobility. It is important to clarify that while this exercise